students here too that are preparing for hospital chaplaincy and hospice workers and whatever. And I think we have Kathleen Golden who's working with you, Ted and Cooper, and my niece Bridget graduated with you there, Jane. Could you guys address how you think the proposed healthcare policy will impact your work? And we're going to fight, but anyway, you can address that.
State or federal? Or both?
Trickle down.
Well, we're preparing with the patient-centered home health, and that's, we're trying to get it structured to where, a patient can come to their PCP, their primary care physician. I think the way that it's going to impact us is we're going to be the example for other clinics, and they're going to be structured the way the federally qualified health centers are, with the patient-centered home health.
So with the Affordable Care Act, if it continues as passed, don't have the individual mandate struck down by the Supreme Court. We actually get to have Medicaid expansion in 2014. It's going to be a huge benefit if we're actually going to be able to get the subsidies to support state Medicaid programs. They're going to be supported at a 90-10 ratio instead of the current 60-40 ratio, at least for a little while, to cover the expansion. The estimates are probably about 90% of Oregonians would be covered with insurance at that point. That's going to be a wonderful thing in terms of our financial status in the safety net clinics, because we're not going to have the big uninsured issue, but there's still going to be huge access issues. I've had some arguments with politicians about this, actually several years ago with Senator Wyden, when he at one point suggested that if we could have universal insurance, we would not need safety net clinics anymore. So I ended up sort of arguing with him about the difference between access and insurance, because there are a lot of people right now walking with Medicaid and Medicare cards that have nowhere to go. Right. And just because someone's willing to pay that bill doesn't mean someone's willing to treat you. Mm-hmm. And so first you've got to have that kind of cultural competence where there are people who are willing and able to treat you in whatever, segment of the population you're in. And then you also have to be able to get good care. There has to be enough clinics. There have to be enough primary care providers. There's still challenges we're going to face. But at least if there's more money flowing in because there's more insurance, as long as people don't make too many assumptions that that's going to solve everything and starts cutting away at the other supports that the systems need, then I think it's really going to be better. At the state level, I'm very excited about what's happening right now with the coordinated care organizations. I think it's an amazing thing that's going on. And I can't speak to how it's shaping up in all parts of the state, but here in the metro area, I've been in healthcare for 20-some years. I've never seen the level of collaboration that I'm seeing now, where you've got large hospital systems that not only were competing, but fiercely competing, practically arch enemies. And you've got now sitting around the table together, Providence, Legacy, OHSU, Kaiser, everybody working together and saying things that would have just been, insane to hear even a year ago. A hospital CFO in a meeting saying that if there's another hospital that can provide a service better and cheaper than his hospital should shut that unit and send his patients to the other hospital that can do it better and cheaper. A CFO is actually saying that in a meeting, and this is just amazing stuff. Now, whether it actually really pans out, there's still a lot of ground that we have to cover, but just the fact that the conversation has moved to the point now where we're talking about what's best for the community, what's the best way to provide health care, and looking beyond health care services, but starting to talk about health. And I'm very guardedly optimistic about the possibility of actually seeing health care and public health and community health actually reconverge somewhere in the not too distant future, where we actually look at things about the built environment like the parks and the grocery stores, and we look at sort of all of the aspects about what keep people healthy. There's been some research in the healthcare side about what is it that creates health, and they've figured out that about 10% of it is what actually happens in the exam room or in the hospital facility, and 90% of it is everything else. It's genetics, it's your social economic status, it's the environment that you're in, and so to have a system that's actually going to start looking at that 90% instead of the 10% is really encouraging, I think.
I just
Well,
want to add, oh, sorry, go ahead.
Well, from the perspective of a natural medicine college, I have no idea what's going to happen to us. But the big piece from a holistic medical provider perspective of all of healthcare reform is that we may be able to change the way doctors and healthcare providers are paid for their services. That the idea, the concept is that we're going to be paid for keeping people well, instead of treating people for diseases that they have or conditions that they have. And if that happens, that's like the most exciting thing that I can conceive of coming out of healthcare reform, is that we're actually going to be, if I keep these 10 people well and away from hospital and expensive care, then I as a provider are more rewarded than if they have to go seek extra care. That's the most exciting thing for me.
And that's what the patient-centered home health is all about,
Mhm.
is, say a patient has diabetes, we're going to track them and get them in for their diabetes checks, their A1Cs, and make sure that they're eating properly and just following the program.
I have a question. Sometimes there's a disparity between general health care and mental health care. Now, I know Central City Concern does a fine job dealing with the mental health issues and the recovery issues and stuff, but what about the rest of you? Do you see mental health? Do you offer mental health care services for people with mental disorders and that sort of thing?
At
Or do you
Rosewood,
refer them,
we
or-
do. We have a behavioral health nurse practitioner. There's some things that we do refer out, but we do have someone on staff that helps with that. Mm-hmm.
I think overall, we see that some of our clinics do have such a provider, but the capacity is not as great as the need. So we get a lot of calls for mental health and have a lot of trouble referring these people to places where we know they can get in and see someone. It's really hard.
Right, because most of our clinics are primary care clinics, and so a primary care doctor can't necessarily manage the kind of pharmaceuticals that somebody with some serious mental health disorders might need, and so there is that capacity is really hard to find for most of our clinics. I mean, anxiety disorder, depression, things like that. But when you're talking about severe bipolar or schizophrenia or something like that, you need a psychiatrist and a higher level provider, and many of our clinics don't have those higher level providers. We have to look for other resources that the coalition often helps us find those.
Yeah, I think it's really pathetic because so many people on the streets do have mental health issues and are self-medicating, and there just doesn't seem to be enough for folks that are suffering.
There's a real capacity issue in Multnomah County, at least. I'm not sure what it's like in Clackamas County, but to get into community mental health care, there's so few resources that they've limited to really high severity. And so you can be really sick, but not be quite sick enough that you're going to meet the thresholds where you're going to get into the community mental health system. And that's why a lot of the primary care clinics have added some behavioral health staff, some psychiatric nurse practitioners to at least try to address that unmet need in the primary care setting. But there's a gap there, definitely.
There is a place for you to refer it in terms of the National Alliance on Mental Illness. They do a pretty good job of linking people up too, so that might be a good referral.
Well, NAMI also does great stuff with peer services, and I think that's also one of the solutions that we're going to see coming with healthcare reform, is that natural systems of support and peer-provided services are really going to be an important tool that we can use.
The other piece of healthcare that we haven't mentioned yet is dental.
Right.
And dental care and how important dental care is to every aspect of a person's health. Nutrition, self-esteem for getting jobs, it just, mental health, it's so important, and it's really not well dealt with in the uninsured and underinsured communities.
And talk about disparities in health benefits. I mean, dental health insurance, in the Oregon Health Plan, for most people, it only covers urgent services, which means extractions.
Right.
So if you have something that's bad enough to be pulled, they will pull it. And that's the end of the treatment. There's then nothing after that. So, I mean, we're fortunate. Medical Teams International brings their dental van to our clinic every month so that at least people who need extractions can get them. But then our docs have had to learn how to manage something called dry socket syndrome, which is as nasty as it sounds. But that's because there's no other follow-up dental services these folks can access. So we've had to sort of learn more oral health care just to provide that kind of follow-up.
Well, we have time for one last question.
First of all, I want to applaud you for the work you're doing. I really appreciate this, and it's been very informative to hear what you guys have been saying, what you do in the community. I'm kind of curious if you can give me perspective of how are we doing in Portland compared to other cities? I mean, I'm impressed with what all of the organizations are doing. I'm saddened by the amount of people that are being turned away. But how does this fare on a broader scale?
I think one thing we do better than a lot of cities is the fact that we have this coalition of community health clinics. Very few cities actually have organized where the safety net system has organized itself. I think LA has something sort of similar. Genevieve, I don't know.
San Francisco has the free clinics. They have an association down there.
Right.
Yeah.
From what I hear, though, the resources here in the Portland metro area are better than what you can find in the Bay Area in California. So there's that comparison. Can't speak for most cities, but I do know that what Oregon is doing, and in particular this UCO transformation that's happening in the Portland metro area is definitely a new thing, and it's kind of groundbreaking, I think.
In the state of Oregon, also the Healthy Kids is something that is unique to Oregon, and other states are trying to emulate that.
I think one of the great things about Portland is that as a community, people have decided and voted and supported financially providing services of all sorts to people who are less advantaged. And I think it's a measure of a society is how you care for the least fortunate amongst you. And I think having lived in a lot of different places, I've never lived anywhere that really stepped up the way I've seen Portland do it over the years.
And as Dr. Sanders was saying about having naturopathic care providers that can also prescribe Western medicines and have that full capacity to function as primary care providers, it's wonderful, and I think that doesn't happen in many places.
And we've got, Oregon Health and Sciences University with medical students that need training. They're these students are physician extensions. They really increase our capacity, both from OHSU, my college, the Oregon College of Oriental Medicine. They have interns that they send, all over the city into safety net clinics and work with some of our colleagues at the coalition. And Western States Chiropractic College now, the University of the Western States has chiropractic interns and residents that they send to these safety net clinics also to give somebody access to a kind of care that can be really, really beneficial. And can I say, I forgot to thank you guys at Marylhurst University, because we were actually a benefit of the one of the clinic cleanups. One of our safety net clinics, the Urban Education Center, which is associated with Mount Olivet Baptist Church, we opened it this year, and it was kind of not in very good shape, and so a group of people from Marylhurst came 2 weeks ago and did a really great cleanup job and helped us spiff it up a little bit, so thank you.
So before we say goodnight to Genevieve, Dawn, Ted, and Liz, I would ask each of the four of you if you have one sound bite that you would like to leave us with. started this in this.
Yeah. A sound bite.
Something you want us to remember.
Yeah, it's, you know, we've said so much, so I don't know whether, you know, we've said so much over the course of the night. Really, I think it's just like give where you can, whatever capacity that is.
Yeah, I like that one. I guess if I had to pull one, I think it's it needs to be about health, not health care.
One thing that Yakima Valley Farm Workers Clinics believes in is that the right to wellness is for everyone, and that's a good belief, and I believe in that belief, and that's why I work at Rosewood, and that's why a lot of the staff at Rosewood are there to help our patients, so that they have some place where they can get their health care.
I guess I would have to say be open-minded. Try not to judge people that might not have the same privileges that you have.
Well, on behalf of all of us at Marylhurst, I thank each of you for coming tonight, for the time you took to prepare to come tonight. But more importantly, I thank each of you for the important work that you are doing and the leadership you are showing in our community. So thank you very, very much for that.